Hi, I'm Dr. Matt Brengman, and this is an article that I wrote for Techniques in Gastrointestinal Endoscopy. It's about endoluminal procedures, which is a fancy word for things we do through the mouth with endoscopy. There's lots of interesting new techniques for weight management that are being introduced, and this article covers some of the bigger and more well-studied topics today. There's a lot of things out there, but there's not a lot of things that work great, I think is one of the bottom lines. The things that are shown to really be beneficial are the gastric balloon, or things that take up space inside the stomach, and gastric aspiration therapy, which has been a little controversial in the medical world, where there's a tube that goes in the stomach and the patient drains off some of the fluid and food that they eat. And so people have I've talked a lot about that. I think the data is good for those. What's really important, I think, other than the procedures are safe, is that they require a lot of intensive follow-up with both dietitians and psychologists to make them work well. And so if you're out there looking for these therapies, you want to look for programs that provide those resources, because without them, the data is not really as good and the results are quite variable.